Struggling to remove those heavy stains during cleaning? Hello, I'm Dr. Paul, a dedicated dentist committed to enhancing your dental health. Here at Dr. Dentfeed, I will be sharing valuable tips to improve your oral hygiene and introduce products that I believe can benefit both patients and my fellow dental professionals. So for today's video, I'll be reviewing the Woodpecker Dental Air Polishing handpiece system, which can help you to remove those stubborn stains. Inside the box, we have the packing list, which contains the list of all the items within this box. The first one is the powder storage chamber or the main unit. It can be opened and there is a marking inside it which corresponds to the maximum level up to which we can add the powder. It has two ends with protective coverings on both ends. One end is to be attached to the handpiece and the other to the dental chair. The second item is the handpiece. We have one handpiece within this box, which is the supragingival one. If you need the subgingival polishing head, you would have to get it separately. Then we have two needles, one long and one short one. It can be used to clear any blocks if it develops within this handpiece or within the main unit. Then we have a detailed instruction manual. In addition to the instruction manual, we also have a tip card which contains essential information regarding how to attach, how to remove and how to take care of your handpiece. It has stickers at the back and can be stuck close to your dental chair for any referencing. Then we have an additional set of rings or washers. Then we have a connector which can be used to connect it to the dental chair. I had used this in multiple patients, one of whom was a heavy smoker and another was a preteen boy who had chromogenic stains. Both the patients were satisfied with the results and the instrument did its work quite efficiently. You can even use this in a small child, but the problem is this equipment is slightly noisy and you might have to do some behavior management therapy to make the child to cooperate to the instrument or to the procedure. Now, I just wanted to go through the instruction manual because there are certain contraindications which are mentioned inside this, because of which certain doctors who might be considering to buy this might not be able to use it. So, with regard to the doctor, the contraindication mentioned is that if the doctor has a pacemaker, then they are not supposed to use it. With regard to the patient, if the patient is a hemophiliac or the patient has a pacemaker or the patient has some respiratory disease like asthma or chronic bronchitis, we are not supposed to use this instrument in that particular patient. The instruction manual also tells us that we are supposed to use only the Woodpecker brand powder inside this. Woodpecker has three different powders. One is the Super Pro, then we have Gentle, and we have a third one called Fast. Fast is essentially sodium bicarbonate powder and it has a particle size of 65 micrometers and it can be useful to remove those stubborn stains which are not usually removed or which are very difficult to remove, as in the case of a smoker. Super Pro is based on erythritol. It also has a particle size of 65 micrometers. Then it contains erythritol, amorphous silica and chlorhexidine. It can be used in your routine cases or normal cases. Then we have Gentle, which is based on glycine. That also has a particle size of 65 micrometers. It contains glycine and amorphous silica. It is useful in patients who have sensitive teeth or in recall visits. So that's it regarding the dental air polisher. Now, if you have any queries, you can drop it in the comments. And don't forget to like, share, and follow.